Okay, now pig tube is placed and is in. Usually we need to wait about 4 hours to use it for water and med. And again, if the nurse call you about this, tell her please call the surgeon or GI specialist, whoever put it in, tell them to direct the nurses when to use it. But a general rule is 4 hours. For tube feeds and nutrition, till next day or 24 hours. And again, I usually tell them, if they call me, please check with whoever placed it and ask them when we can use it for nutrition, because the concern that if you use it early, that some of this may spill into the peritoneal cavity and cause peritonitis, which is again all of this theoretical, but we take these precautions just to make sure we don't get that. Now, your patient has a pig tube, so when you examine this patient, part of your daily examination is to look at this pig tube and see how the pig tube itself look and make sure there is no complications. So first of all, of course, you ask the nurse if it's functioning fine or not. So that's one thing. You look for any signs of infection, right? And also, before we continue on this, one things you may see after pig tube placement, if the patient gets a chest x-ray or abdominal x-ray, you may see air under diaphragm, and that's okay. This is expected, and sometimes you can see it as long as the patient is not having signs of acute abdomen. Then you don't need to do anything. At any point, if you are in doubt, check with the person who placed it, but that's something you can see. So it's not peritonitis or acute abdomen or perforated viscous, as long as there is no sign of acute abdomen. But again, if you're in doubt, check with the person who placed it. Back to this. So signs of infections, erythema, discharge, etc. And to examine that, make sure the gauze is placed on top of external fixator or a bolster, because you want to avoid any tissue compression between, let's say this is the abdominal wall and this is the stomach, this is the tube, and there is a bolster here, a bolster here. You want to avoid any compression of the tissues in between, because any compression can lead to this external bolster to erode into the skin and causing pressure ulcer and get buried inside into the skin. So that's why we don't like to put anything underneath this, usually on top. Anything, if you put it right here. So that's part of your examination, looking for wounds or pressure ulcer, right? Make sure abdomen still soft. That's part of our examination. Look for any leak or spillage from around the catheter, so around the tube. So these are the main things. Now, general care, and usually this is a nursing issue. Just to give you an idea, usually flushing every few hours with saline, and flushing after giving medication with sometimes 20 or 30 cc of normal saline, usually warm. And also avoid, as in NG tube, extended release or sustained release medications. Avoid bulking agents like cholestyramine. Should not use it. And the nurses are pretty competent in this. They're pretty comfortable to know which medication they can use and which they cannot use. So this is the general care of pig tube Next, we'll go and start talking about probably troubleshooting.